afternoon and welcome to the Executive Committee meeting of the Lane County Poverty and Homelessness Board. Welcome. Let's go around the table and introduce ourselves. You want to start, Michaela?
Sure. I'm Michaela. I'm a part of the 15th Night Youth Action Council, and yeah, that's it.
Great. Welcome.
Thanks.
Oh, this way?
Yes.
I'm Pat Farr, member of the committee.
Great.
Chris McAllister, adult consumer.
Alex Dreer, Lane County staff.
Noreen Dunnels, United Way.
I'm Pat Walsh. I'm with Vox Public Relations.
Steve Manella, Lane County Health and Human Services.
Sean Van Gordon, Springfield City Council.
Stephanie Jennings, City of Eugene staff.
Amanda Borda, Lane County staff.
Well, great. Welcome, everyone. If there's anybody who wants to speak at the end of the meeting, there's a sign-up sheet over here, so feel free to get your name on the list. Let's take a look at the previous meeting and the consent agenda. Has everybody had a chance to look at it? Are there any changes or additions to the minutes from our previous meeting, or any questions about the financials? If not, I'll entertain a motion. So, okay, Chris, you get a second.
Second.
All in favor to accept the minutes from the October 17th meeting and the financials, signify by saying aye.
Aye.
Anybody opposed? All right. If not, that passes. Announcements. Let's start with Alex. She's got an announcement about Father Waz.
The Poverty and Homelessness Board had selected Father Brent Wass for the faith-based representative position, and he has resigned as he's moving out of the community. So right now we have that vacancy, and the Poverty and Homelessness Board can appoint someone to fill his position. I met with Rabbi Ruchi Rubenstein from Temple Beth Israel. She said she is interested in the position, but due to scheduling conflicts, she would miss February, April, and June meetings. So she's open. If you have another candidate, we can invite them. I've sent out the blurb requesting people to speak with me if they're interested in filling the faith-based representative position. Please send people my way.
All right. Well, thank you, Alex. I know Chris and Amanda have both got announcements that they'd like to include in these updates, so that aren't on our agenda.
Thank you, Chair. Springfield was able to open its doors for 6 hours on a day that Egan was not going to be open, even though it would be dipping down below freezing. We were able to help 63 people, of which 55 were on site. We gave them warm food. We gave access to sleeping bags, tents, hand warmers, and whatnot to get through the night. It was a team effort with Carry It Forward, Hope on Wheels, Occupy Medical, Everett Methodist, who was our host, and we also had a big group of our core Egan volunteers. And so we feel like it was a very successful action, and I feel like we helped save lives. And I'm really proud of our community in Springfield because, as far as I understand, the mission was full, Dusk Till Dawn was full, and we offered alternatives. And so we were the only thing that I know of east of Florence, which opened up its shelter that night. So, thank you.
That's amazing.
Can I just offer that Fern Ridge and Veneta, one of the churches also opened up.
Awesome.
And I'm not sure how many people they serve, but they called me because I'm on the list.
Awesome.
And again, I just don't know what the volume of people were, but I know that they're activated.
Awesome. Thank you.
That's terrific. Great. Good work. That's wonderful news. I hear that. Amanda.
Sure. So I just have a couple of quick COC announcements. You might have seen an email come out about some awards we received for our last application from fiscal year 19. We did receive our Tier 1 awards. So that's the first of two announcements. That's about $3.5 million. We're still awaiting to hear about Tier 2, which includes one renewal project for our connections. The majority of connections TH fell into Tier 2. And then a bunch of expansions, which were new funds for expanding existing renewals. So those are pending. We should hear probably by early February on those. So far promising. We did receive some increases for FMR adjustments, it looks like, for most of our renewals. But that's the only change there. The other announcement is that the COC registration for this competition opened the same day. So That's just a quick early step that the collaborative applicant, which is Lane County, we just kind of go in there and register and basically let them know that we are registering for that opportunity for this fiscal year 20. So I will do that on behalf of this board and the continuum of care.
Thank you, Amanda. That's good news. I hope you also, there was also an article in the paper about those awards that were in today too, that I thought was very good. All right, anything else from the group? If not, let's move on to Steve Manila and update on the TAC implementation.
Good afternoon, everybody. I'll give you a brief update on the TAC implementation, and otherwise known as the Homeless Solutions Alliance work. We are actively working on the 10 strategies that were recommended in the consultant's report. What I can tell you is that we are going through. I didn't get that. We're going through a sort of a realignment in how we're doing our tactical work. So, many of the strategies are outlined, and I'll just go through them: street outreach, diversion, rapid rehousing, utilization of existing permanent supportive housing and vouchers, move-on strategies, tenancy supports, coordinated entry, landlord engagement, and training and emergency shelter. So we have work teams that are working on most of the items that are on the strategic plan, but tactically, we're going through a realignment where we're putting in place an incident command structure between Lane County and the city of Eugene. And as you can imagine, really the good news with this initiative is we have the interest of a number of different organizations and a number of different levels of work within organizations. An example I'll give is within the Lane County, the Lane County management team. All of the directors of the departments has taken it on as this is the most important thing to them right now, is to assist with the implementation of these strategies. And also at the policy level, we have the involvement of the county administrator and the city manager, the assistant city manager in Eugene, and then Greg Rickoff, who's our chief operations person for the county, as well as Karen Gaffney, who is the director of our health and human services. So with this structure, what we're looking at is we'll continue to have a policy team, but we're morphing into an implementation team. And the idea of the incident command structure is so that we have 2 lead people from both organizations, and so that we have communication going up and down and through each of the organizations, so that so everybody is getting up-to-date information and communicating and has an idea of what's going on. As you can imagine, the good news is having more people involved and wanting to be part of the solution, but then that makes it more difficult because keeping everybody informed who's involved in different ways with different decisions, it becomes more complex. So we're hoping that that's going to work out well for us. As part of that effort, we had a interagency siting team looking at sites for the development and creation of navigation and shelter, that is part of this effort. And so we went through a process of identifying criteria, looking only at publicly owned sites, and then going from about initially from over 20 sites to 11 sites, and then 4 sites, and now there were 2 sites that are in the process of being, what do I want to say? Anyhow, the process that we're using is bringing those two sites to focus groups, and those focus groups are, Peter Chavon from the city of Eugene. One of them was a mixed group of people with lived experience, business, and clergy. And I think Dan Bryant participated, who's here, participated in that one. There was one last night for people with lived experience, and then there's another one on the 23rd. And the idea of those is to sort of go through and look at what is what's good about this opportunity, this site, what might be bad about the site, what kind of issues it might bring up, and then that information is going to come back to the policy team, who will make a decision about whether to pursue those sites or begin again and looking for other sites. But the goal is to have a facility up and operating by by next November. That is the goal. So, and that goal sort of also framed the availability of different sites, because if you have to go through a land use process or, something, or a large environmental review or something that's more complicated, it's going to slow down the development of the site. We also have a group of people who are working on the program.
Steve, back to the site.
Yeah.
Who makes the final decision on the site?
That's a good question. I think
I would think the commission.
I would think the city council and the board of county commissioners, because I think that it requires an outlay of resource that both organizations would have to bring forward in order to do that. Yeah. Yeah.
Given that both sites are potentially adequate to house 75 people, is there any chance that we could look into resources, especially with the declaration of emergency, should it come from the state, to secure both sites, so that we would be not only going above our 130 that we get a month, but also put 10 tents into our current population?
I'll answer that in a couple of different ways. One is, Chris, that in the first focus group that I attended, there were folks who attended that focus group, and Dan, you can correct me if I'm not right, but I sort of heard that there were people who were interested in, wouldn't it be wonderful if we could acquire both sites and do things at both sites? The other thing I'd tell you, at one of the sites that is a existing structure, we had gone through a fit exercise with an architect and determined that in addition to the navigation center, shelter, and all the amenities that go along with that, that we could house a medical clinic and 15 or 20 medical respite beds in the same facility. So, and that would be for people coming out of the hospital who needed that kind of care. I think that, the other part of that is, we put together, and Pat can talk about this, he's on the communication team, but we put together, I wasn't really part of this, but a one-page flyer for legislators for this short session. The Speaker of the House has talked about a one-time investment of $100 million for shelter expansion, and no one knows exactly what that proposal is yet. I think I heard today there should be some more clarity from the Speaker's office next week. The other element of it is legislation that would give more options to local jurisdictions around zoning codes and regulation around siting shelters to give more flexibility. I need to move on from that. We also, I think it's been mentioned at the PHB before that we're part of a group of 10 communities that were selected to be part of a permanent supportive housing institute, and that affords us an opportunity to access, there's, during the biennium, there's $50 million. Initially, there's $20 million being allocated for permanent supportive housing. So we're working on a 20-unit permanent supportive housing project for families. And then we also now, going close behind that, have an interest in another 40 units. And so right now we're working on about an additional 60 units in addition to the 51 units that are being developed at MLK. The last thing that I just want to mention today, given time, is that the City of Eugene and Lane County, we've had a team of people who've been working on coming forward with a proposal for coordinated outreach. The hope is to add additional outreach this spring, and the spring timeline is based upon being able to contract, hire, train, and then get people out on the street. But we're hoping to increase the outreach presence prior to doing some of the other development and implementing some of the other strategies on our list. So that's my report.
Okay, the only thing I want to add to that is that this is just that we've been vetting candidates for the strategic initiatives manager, or the homelessness person, and we are, the city manager and the county administrator have interviewed one final candidate, and I know that they're working on with that now, and then there's been a late entry into the pool who the 3-person committee is evaluating and will determine whether they'll move on to another interview. But we're very close to having that strategic initiative manager hired, I believe, providing everything works out, of course, with reference checks and other things. But it's a very big positive step forward. I think in terms of communications, you're going to start to see more come out in terms of what's happening and how what is happening throughout the city and the county ties back to the TAC and ties back to the Poverty and Homelessness Board strategic initiatives. So look for more information as we have things solidified and that we can actually begin to promote things through social media, traditional media, and other means. So that's what I have to add to Steve's report. Thanks, Steve.
One other update that I'll give that isn't part of the TAC implementation, but you may have read this, that the City of Eugene and Lane County added additional resources to add 64 additional beds at dusk to dawn. They had a waiting list of around 50 people, and so a commitment to that and to begin to reach that capacity by the beginning of February, as well as additional resources that went into the Lindholm Center to provide supportive services to folks.
Chris, did you have your hand up? No.
He answered my question.
Oh, okay, great. All right, well, thank you, Steve. If there's not any other questions for Steve regarding TAC implementation, let's move on to the point of time count.
Great. The point in time count is 2 weeks from today. So Thursday, January 30th, volunteers will be out on the streets and at service providers all day from 7 a.m. to 7 p.m. collecting surveys from people experiencing unsheltered homelessness. This year we have 5 deployment centers where volunteers will check in and out. The deployment centers are in Eugene, Springfield, Cottage Grove, Veneta, and Florence, and we've got really excellent rural volunteer local groups that are organizing. For example, in Florence, the local volunteers there organized a breakfast and a lunch at 2 different sites, and they also raised funds so that they could purchase the bus all day, so the bus is free in Florence on the day of the pit count. That's in addition to the day pass that is given as an incentive for completing the survey. And so far, we have 150 volunteers signed up to collect surveys across the county, and then another 50 providers or people who work in social and human services who will be collecting surveys through their work. And then we've also spoken with food pantries, McKinney-Vento liaisons in schools. So we've got a pretty wide touch as far as who will be collecting surveys on that day. This year, we have an electronic-only survey collection using the Counting Us app, and we've heard really positive feedback from it so far. All the volunteer training is next week. There's a volunteer training in each city where I said there's a deployment site. So this is pretty much the last chance to sign up to volunteer. Are there any questions about that?
How do you want us to do you want to sign up online, or what's the method?
Yes, so if you'd like more information about the point in time count or to sign up to volunteer, go to lanecounty.org/homeless count. And we have volunteer opportunities. If you're not comfortable going out on the street and talking to people, I've gotten some emails from people who say, I want to help, but I am an introvert, and I say that's great. We need volunteers in our deployment centers helping us check in and out volunteers and getting the volunteers ready to go out to the streets.
Chris?
Did you say there was 120 people currently signed up?
Over 150 volunteers.
And how many do we actually need to make this go smoothly?
We are all right on volunteers, but we can always use more.
Okay, thank you.
Can I just offer, I did this for the first time last year and found it to be a very enriching experience to really understand circumstances. And I unfortunately will have to be in Portland that day, but if you have the time and can take the time, I know we've really tried to promote it at United Way as well, and we have the link to the county site. And I think we've captured a few volunteers who are interested. But I would just say it's a really important thing to do, particularly for those of us on the steering committee, just because it gives you a sense of reality of what folks are facing. And so that's...
Thank you. And the volunteer commitment is a 3-hour shift, which includes time to check in and out of the volunteer deployment center. And all volunteers are sent out in pairs, and they do receive training, so you're not going out alone. We're not asking you to do anything that's outside of your comfort zone.
Good, thank you. Yes, be sure to sign up. Thank you very much. Steve, do you want to talk about the state homelessness emergency? Thank you. Shelter.
Yeah, I alluded to that a bit in the previous item, but I do want to say that it makes sense for the Poverty and Homelessness Board and for this executive committee to think about, you know, the best way to interact with the intergovernmental relations folks from Eugene, Springfield, and Lane County, and maybe how you all communicate if there's a need to speak to legislators or to do things in support of, you know, again, the one way to look at this is that there are really two different proposals. So one is sort of, and I don't know if you want to have some discussion now, but is this thought of, you know, the state government, as they've done in some other states, giving more authority to local governments to have flexibility in citing and code and we haven't seen the draft legislation on that yet that the speaker has. And then the other piece of this will be, you know, through the appropriations process, is the availability of funds to expand shelter. And as we know, you know, the speaker's proposal is for one-time money, which is very handy for the capital part of the approach. But then there's the ongoing operating costs. And for example, on the navigation center, you know, the cost of operating the navigation center is probably going to be somewhere around this is both operating and services, 1.7 million a year. And that's just an estimate. And so anyhow,
Okay. Well, what do you, I'm not trying to understand what you're asking for.
well, I guess what I'm asking for, two things, is how you want to coordinate communication on these items with the group. And then the second thing would be how you want to, process any action. And I don't know, the Eugene and Lane County intergovernmental efforts are sort of in tandem, in agreement, and I think there'll be outreach to Springfield too, to look at that. And I think the other thing that I expect that people will want to comment on is, as the details of various proposals get put out there, there may be things that are specific to those proposals that people like or they don't like, or they would like to see changed.
Sure, understood. Commissioner Farr.
The way Lane County's outreach works, our legislative committee is scheduled to meet tentatively next Friday. There's a little bit of flux on that, but as you all know, we have a intergovernmental relations manager, which is Alex Kyler, and Alex coordinates our efforts. Alex gets his work plan from the Lane County's legislative committee, which is approved by the Board of County Commissioners. And as you all know, once again, I'm not telling you something you don't know, Alex is really on top of things, even as they're coalescing. Yeah. So as far as the effort for Lane County is concerned, the coordination with the city, a lot of that will be discussed at the meeting next Friday. And there are 2 county commissioners on that committee, as well as department heads from the county, as well as, and Alex is the one who prepares that work plan. So it's, things are still in flux a little bit, but it's going to be a pretty directed effort once the time comes. And once we come up with our legislative priorities, which this will be one of them, I'm only one of the people, but I can pretty much guarantee this will be one of them.
Sure.
Then we'll put a great deal of effort behind it,
right,
including the targeted legislators to talk to and the way to actually handle the business of the capital.
Do you think, is that an opportunity for for people from the Poverty and Homelessness Board, if they're interested or feel strongly about it, is to be able to help testify at hearings and do some things like that?
Absolutely. Yeah.
So
this board is very, very powerful.
Yeah. So what I'm wondering is if, and I hear everybody's feedback on this, is maybe what we ought to do is have an ad hoc legislative committee in order to support the efforts of Lane County and the city of Eugene as resources as needed. Does that make sense?
Absolutely, and I think Steve will be in attendance at the legislative committee meeting, I'm sure, when it's finally announced. We're having trouble getting one of the commissioners to come up with the date, but it's, before the short session, which is
Rapid.
Tomorrow.
Yeah, we have notes. Yeah, we need, yesterday,
Now.
right? Mhm. Yeah.
Sure. I'm going to go Sean, then Chris.
The format for us works the same way from the city of Springfield, except it's not Alex, it's Neil Ladati.
Right.
So,
Neil is fantastic.
yes.
Yeah, he is.
Our legislative committee is coming up. My suggestion would be maybe to try to have the intergovernmental managers maybe meet and try to get on the same page, because I'm pretty sure that, everybody's got that same set of committees to bring some of the information back to it.
Sure.
But it's the counselors that sit on that legislative committee that sort of drive Springfield's work plan in the legislature. Now, the other thing I would point out is what we're hearing from, on our side is that really nothing's going to move, if in Salem over the next month. And so I think the conversation here needs to be sort of conscientious of the fact that they may just try to successfully have a session, get done, and leave and go home until the long session. So we may want to have this conversation thinking about the long session the year after.
And constitutionally, they have to have the short session, but it can be gavel in, gavel out.
Yeah,
right.
Yeah. And the feeling that we're getting is that if people successfully show and they successfully pass what they need to, that people are going to go, okay, we're done.
I'm optimistic. I am. And I think the other thing that's happening right now is the federal legislative priorities are being vetted by Neil and by the city of Eugene and by Alex for the upcoming United Front trip. So they meet on a regular basis. And I receive a lot of my information directly from that committee. So.
Chris, and then I've got a question for you, Stephanie, when you get a second.
Well, our strategic plan 3.2, A and B are relevant to this work. And so I feel like that this is appropriate without necessarily even having to consider TAC. We can incorporate Springfield with our strategic plan. They've been partners. They've been here from day one. My concern about the legislation, and I just want to make sure that that when we do make a recommendation that we consider this. In our town of Springfield, all of our zones can currently have emergency shelter. It's that NIMBY stuff that's keeping it mostly out. And so we don't have anybody that's really wanting to take on the one spot in the entire city. So I think that if we advocate for or ask for things, that we should look at a whole city approach, something that provides services in every ward, something along those lines, so we can make sure that's everybody's lift as opposed to one community's carry.
Yep.
And so if we can have that put into our recommendation or request, that way we can give support for communities to be able to do it. And then it's no longer on the government's hands to just solve everything.
Makes sense. Makes sense. Stephanie, the question I have for you is, does it, I presume that the city of Eugene with Ethan works sort of the same way with the council. Yeah, I didn't want
There's
to,
an intergovernmental relations committee that includes 3 counselors. And so all direction around legislative advocacy, he works with
them.
committee.
Okay.
And I can certainly touch base with him and just let him know that this is definitely something that's a hot topic, but I would expect that he probably is already.
He's on it.
He's on it already.
He was at our meeting yesterday.
He's on it already, yeah,
Perfect.
yeah.
But I think in terms of bringing those folks together after each of your bodies have met, you guys take care of that, and then we can figure out how to implement people from the Poverty and Homelessness Board as needed.
Absolutely, and Alex will kind of be the coordinator. of
Okay.
that.
Okay, does that make sense? I don't want to create a superstructure.
Has to happen rapid fire.
It's
That's
gotta
the
be
only thing,
quickly.
because it's a short session. Just so everybody knows, the other thing is, United Way United Ways in the state of Oregon also have a policy plan in housing and supporting folks who are unsheltered as part of that plan as well. So I think there's momentum from multiple bodies, not just governmental. And so I think that's just important to know. And we do have a session scheduled, I can't remember what day, but someday in February. So
You know, Noreen, that's the power of this committee, the Poverty and Homelessness Board, is all of those groups are at the same table.
Same
It's the only
table.
place that
Yeah.
all of those groups are at the same table.
Yeah.
Right. Yeah, it's well,
Yeah.
our committee, yeah, that's right. Thank you. Anything else on this? So we've got kind of a plan of action, and we'll just follow up on this, and we'll make that work. Steve, anything else, or do you want to move on to the next topic?
I'll move on to the next topic, and I'll apologize for being the main speaker today. So one of the things that we talked about with the chairs, and has been something that's been on the table and discussed here at the executive committee on, is reviewing our current governance structure. And this isn't meant to be a complete presentation on this, more of just to give myself and others as staff some direction on how to work on this. But the Poverty and Homelessness Board is, when we chartered it as a county advisory committee. We have intergovernmental representation from Eugene, Springfield, and Lane County. One of the things that has come up in our discussion recently over the past several months has been alignment between what's happening with the tactical work on implementation of things like the TAC initiatives with the work of this board. And so, part of it is taking a look at our governance structure and looking at maybe how we can align both we're going to be talking about the strategic plan next. Alex is going to be going through that, but how we can align both our strategic and our tactical work between the jurisdictions. So one of the things we discussed before was a intergovernmental charter, and and so I brought some information from King County. I had intended on having the information from Multnomah County, City of Portland, City of Gresham, and there's a group of us who are going up there tomorrow to view the navigation center up there and to also meet around how the jurisdictions coordinate their policy and services. And so that will provide us some more information on this. But, you know, one of the things that we have in the current structure is two things. One, it's a county-only advisory committee. And then secondly, what we have is we have elected officials and then community members who are appointed from the community. And something that has been very helpful in the, like what we're doing in the TAC implementation, has been having representation of the executive branch of the local governments as a part of the executive or policy team moving things forward, as they're responsible for their organizations and moving forward resources. So it's just and then we've had staff have come to me and we've had questions about, you know, we have a committee structure in place and people have said, well, I'm on this committee, but, you know, there's this group over here that's making decisions about the topics that we're supposed to be working on our committee. So it's a real good opportunity now to talk about how we can better align to move our work forward.
Okay.
I was just going to ask, what, yeah, I know we talked about this a little bit. What are you thinking about in terms of the timeline? It'd be nice to have some, you know, presentation on what these governance structures look like, because I think
Right.
I support a new structure.
Yeah.
So are we thinking we'd like to have that completed by March or the end of the fiscal year, or?
I think it's something that I think needs to be, I wanted to get the temperature of this group today because I think it's something that needs to be taken to the
bodies.
the city managers, Eugene and Springfield, and the county administrator, and then sort of folded in with the other work that we're doing to sort of say, you know, this would be the goal of when we think we'd like to have something in place. So I don't have any plan or timeline or anything around it. I'm just, the thing that I see is that the direction this goes could influence what we do and what our subcommittees do.
Yeah, I guess I feel a little sense of urgency with that.
Okay.
Urgency in the sense that I know things don't happen overnight, but if we were thinking about June 30, all of the steps, sort of working back from sort of a timeline, so that the county commissioners, all of the bodies that really need to vet it, would have an opportunity to do that. So
And I do have more of a timeline than Steve, and it really does kind of match what you're stating. Steve, could you briefly talk about the Human Services Commission makeup and its governance, and compare it to what you're talking about for the potential new governance for this committee?
Well,
the difference between the two.
The difference between the two, the Human Services Commission is still, Human Services Commission, the model of the Human Services Commission was developed like a budget subcommittee of the jurisdictions, budget committees. And so it has representation from county commissioners, city councilors, and then it can have membership from jurisdictions' budget committees. And its primary function is to make decisions around allocation of resources in support of human services for the jurisdictions. And so money is allocated, and there are general funds and other grant funds that there's some discretion on how to allocate those, and that body makes decisions. The way this differs is because of the need to to transform systems and to get operations in place on a larger scale to tackle the issues of that we're talking about. You know, it would include folks, like I said earlier, so the similarity between King County really copied a lot of Multnomah County in that you have, you know, on the executive committee, you have the county executive who is on the executive committee. It's a little bit different in Portland, because in Portland, the form of government in different places is different. In Portland, you have bureaus and you have city councilors who are over bureaus, and so that changes the complexion. But the way it would differ is that it would have that kind of a linkage on the executive team. In both structures, they have sort of a executive committee who has a lot of decision-making authority and influence over moving things forward, and then they have a broader continuum of care board, you know, that meets, and so, you know, that's essentially it.
And that does. The one thing I point out is that right now the Poverty and Homelessness Board, there's only one jurisdiction that gives it authority, and that is Lane County.
Right.
And a different model would have different jurisdictions giving it authority, which would really increase the magnitude would be
Right.
would be exponentialized.
Okay.
So, and I'm fully in favor of it. I mean, as a county commissioner, am I willing to say, well, let's share the responsibility? Of course I am. You know, because it's the work is done by the three jurisdictions represented here.
Right.
But not only the three jurisdictions, you know, we have rural members, we have.
Right.
Right.
And so there's nothing like it anyplace. And consequently, the work that Steve is doing, presenting a potential governance model change, is really essential right now. I'm excited about it.
Yeah, I am too. Chris, and then Councilor Van Gordon.
Councilman Van Gordon, quick question. I know that we are currently looking for a new city manager. When will we might possibly be finished with that search to where we could tie it into our timeline?
Well, I was going to volunteer Pat for it.
I'll second that.
I didn't say what Pat.
I was just gonna.
Say which one?
So our city like the candidates are here right now. I met with them this morning. The official interviews with the city council are tomorrow. You can come at 5 o'clock at City Hall and meet them and give some feedback. So I would assume if everything goes great, right, then there's gonna, you know, we're not that far away, but they still have to get here, get settled, all that kind of good stuff.
So if you want Springfield involved, looks like we might want to have a little bit of a buffer. City manager, new dream, new vision.
Sure.
Gravitas.
So I guess my question really would be around getting more details about what an intergovernmental agreement would look like, and you know what its actual sort of requirements are, because for Springfield it could, right, like if it, you know, that the structure really is going to depend on how much support there really is, right? Because Springfield really has got a specific vision for how they want to accomplish these things.
Right.
And I think there would be a lot more questions if it's sort of taken us away from where the council kind of wants to go right now. But that doesn't mean you shouldn't have the we shouldn't have the conversation, figure out what it is, right?
Right.
Because right now we're saying, you know, maybe we should move to an IGA. You know, well, there's lots of different versions of that.
Right.
Right.
Right. There's a lot of details to be worked out.
So I would say curious, right? But I would, you know, I think we should move forward, have the discussion, and then there might be additional questions that come along, you know, out of that.
Right. I think that sounds good. I too am of the opinion that I think that we need to take a really strong look at this and figure out what's going to be best for the region, you know, and I'm glad to hear there's interest in potentially sharing some of the responsibilities and some of the actions on some of this. So, yes.
I just wanted to mention to Sean, I think something that will be helpful for the city of Springfield is in checking with the city of Gresham. And then I was trying to remember with King County, there's also a smaller city that's part of their continuum of care that is part of the agreement, you know, as well. So the experience of you know, communities of the size of Springfield and working with larger jurisdictions in this kind of an intergovernmental agreement. So, and we can give you the examples of the intergovernmental agreements from these other places as well.
That would be helpful, right?
yeah.
But I would, I guess from Springfield's perspective, right, like, we don't see ourselves as the smaller community at the table, right? Like,
Okay,
right,
I didn't mean that.
Right, but like it's not like, but like the council, you know, when we talk specifically about regional issues, right, we're looking for kind of like shared goals, but we get to
Right.
define how we get there.
Right.
And creating space for us to kind of define the how for our communities is what my council's going to react to.
Right, I got that.
So what's our next steps with this? Because we need to move on to the strategic planning part of this, so.
So I will work with staff. When I say staff from Eugene and Lane County, and the folks who have been working on policy around these things, and then come back. And so I think the you know, July 1 timeline alignment with the fiscal year makes good sense.
Okay.
But I don't know right now until I speak to those folks whether or not I'll be bringing back something to the next PHB meeting or if it will be the next executive committee meeting. But I'll be able to inform you soon of the feedback.
Okay. Well, that sounds good. Yeah, quick.
Sure. Quick question. How do we decide, like, since it's about governance and we can always pick it up at another time, how do we decide who is ex officio? How do we decide who's at the table?
I think that's down the line.
Understand, but I just wanna-
Yeah, but that'll be part of whatever.
Chris,
Plan goes forward.
that's a good question, because that's one of the other things that's come up in our current governing structure. We've gotten feedback from people who are ex officio who've said, is there some way we could create a governing model where on the broader continuum of care, nobody would be ex officio? So, and
Steve, can I just say, if we could have a couple of different models, you know, and how ex officios are determined and
Right.
and voting power and authority,
Yeah.
all that's going to be really helpful.
Yeah.
okay.
Yeah,
Part of
thank
that
you.
plan, but
Yes.
thanks for asking.
Yeah,
I'm glad you
that's
asked
a good
that.
question.
Yes.
I know we got to get going. Just one last
Yes,
thought
sir.
here. Like the PHB current governing structure is confusing and convoluted. It kind of feels like the system of human services support in the county, right? It's confusing and convoluted.
Oh, man.
Let's not go there.
I know. Sorry, Noreen.
No, I
I think-
don't take it personally.
If
No, we don't either.
Like, whatever that governance structure is, right? Like simple, right?
Right,
Like,
exactly.
Right.
Exactly.
Got it.
I agree with you. No, I understand. Thank you. Thanks for your comments. Let's move on to the revisions to the PHB strategic plan. Alex, and I just want to say to the group that I have to book out of here in about 20 or 25 minutes. So Noreen will take over. If I get up and leave, it's not personal. So I'll be in my way. So anyway, go ahead, Alex.
All right, well, we have been going through a process to analyze our current strategic plan, which runs through 2021, and identify which strategies the Poverty and Homelessness Board would like to focus on, given the detail that's in the current strategic plan and all that we still have to achieve. So at the last executive committee meeting, this group decided to focus on 3 different strategies within our strategic plan. Those are Operation 600, which is creating 600 additional housing opportunities throughout Lane County for chronically homeless individuals, people with special needs, including veterans, youth, survivors of domestic violence, people with mental illness, substance use disorder, people exiting the criminal justice or foster care or child welfare systems. That's Operation 600. And that also aligns with the TAC recommendations to create more permanent supportive housing. The second item that this the executive committee decided to focus on was to create additional emergency shelter. That's also the pressing need in our community. And the third one is to advocate for support to reduce poverty and homelessness, which was largely the topic of the first half of our meeting as far as legislative advocacy as well as state and local. So we sent out a survey to all of the subcommittees for their feedback. First of all, asking subcommittees of those 3 priorities, creating more housing opportunities, emergency shelter, and advocacy, which ones is your subcommittee going to focus on? Almost pretty much all of the subcommittees have their own strategic plans or work plans that are more focused on what they work on. For example, the employment subcommittee, all of their work plan is related to employment opportunities. So we got the feedback, which is on the cream puff colored paper in front of you. This is what the subcommittees said they would like to focus on. And then the second opportunity in the survey was for our subcommittees to say, are there any strategies that are not on the current strategic plan that you'd like to add? In particular, when the strategic plan was first written, there was no Youth Homeless Solutions Work Group. There was no Lived Experience Advisory Group. I think there was no healthcare committee. So we have had a lot of, no employment committee.
Right.
We have all these new groups who have their own work plans. So what is missing from the overall body's strategic plan? So this is what we heard from them. And I can, as we review what the feedback was, what it is up to this body to determine is what should be added to the full Poverty and Homelessness Board strategic plan. And by that, I mean all this work is very important, and for the most part, the subcommittees are already working on these items and going to continue to work on them, but which items need the full body of the Poverty and Homelessness Board, all members' support, and to be elevated to these meetings, the executive committee and the all-member meetings, to really push them through with the goal of 2021. So, with that, we can go through what the committee said, piece by piece, and thankfully we have representatives from most of the committees here today. So the Youth Homeless Solutions Work Group, their main focus of the 3 priorities is shelter. You heard from them the Youth Homeless Needs Assessment, which identified in particular a need for shelter for transition age youth who are 18 to 24, as those youth are pushed into the adult system, even though it's not necessarily developmentally appropriate. So the Youth Homeless Work Group is very interested in creating additional shelter opportunities, in particular for youth. And then the other strategies they wanted to focus on were increasing all housing options for youth, which is here transitional housing, rapid rehousing, permanent housing, as well as increasing youth employment opportunities, which is something that can also be relevant for the employment subcommittee. Are there any questions or comments about that? Or maybe we have Michaela here who's on the Youth Homeless Needs Assessment group. And I think this main additional comment came from Michaela.
Yeah, that one I feel really strongly about, that we do, it says here, we need flexible funding that allows for youth who are couch hopping to be eligible for housing resources. At our last meeting, I got a little upset because I found out that there were 2 housing opportunities that there was no one on the list to fill them. And that really upset me because I was like, there are so many, 580 plus homeless or unaccompanied youth that we know of, that 2 people could have greatly benefited from that, yeah. And so I think that a lot of that also is based on the funding, I believe is what we talked about. They have a lot of rules around how you get into the housing. Like the housing that I'm in, I had to have a disability, prove that I was homeless for a certain amount of time, and there was a lot of hoops to jump through. And I think I do want to say that it's been heavy on my mind thinking about, while overnight shelter is extremely important, I think that that's just a Band-Aid on the biggest problem, which is permanent housing. I think, I know that everybody knows that. I just want to say, like, yes, it would be amazing if we could get another overnight shelter, but it's just a Band-Aid, like I said. And I think that we should be working harder towards having more permanent housing. And I was wondering if these new people that I only know so much about politics and all the stuff you're talking about, but I just want to make sure that we would have a voice. If those new people came in, that we would be able to kind of run that. And I was also wondering if maybe that would expand funding for more permanent housing, adding more people on. I don't know if that makes any sense.
It does.
Okay.
Yeah, absolutely. Interesting. I mean, yes. I don't know if it does or not, but we would have to look
Yeah,
into it.
that was just, I was going to say something
That's a
earlier,
good
but I was
option.
like,
No,
not sure. So
good.
anyway, yeah.
Thanks. That's important.
Can I ask a question? Of that youth, of the homeless solutions, the youth homeless solutions, the work on the RFP at the Serbu, the reconfiguration of one of the pods, probably wraps into
that.
But that's another example, Pat, of some other group is doing the work that committee is integrally responsible for.
Yeah.
So how do we integrate the work that's going on out there with what I believe should be the central discussion point, which would be the youth homelessness solutions group, work group?
Yeah, I think
Circle's gotta get
I
bigger.
think it's been part of the discussion, but the Serbu campus discussion has been around a younger group of people.
It has.
And so this is the focus that this work group has been talking about is the transition age youth
Right.
that would be older than the kids that they were envisioning being served out at the Serbu campus.
I do think that the pod does go till, I think you're right, till 18. Doesn't go to 24. I'm not sure on that though, because there
Right,
has been
right.
a lot of changes. They said we were going to be able to move people in this October. Things have changed. So really,
So there is coordination going on, and I know that's been brought to the committee.
Well, I think that, and Noreen just said this to me, is it what, you're making the case for us to expand the circle bigger, you know what I mean, in order to get more people involved into reporting.
And at least make certain that all of the information is being funneled into
something.
because of the poverty and homelessness.
Right, right.
Because this is the only place where we have all the jurisdictions.
But we've got everybody here.
Only place in existence. Other than, you guys.
Well,
You have a lot,
let's
too.
not, we can talk about collective impact and that kind of modeling and what we, yes, I'll go there.
Great, thank you. Thanks.
Yeah.
You bet. Anything else, or you want to move on to the next one?
Sure, let's move on. So the healthcare committee, you heard at I think it was the last executive committee meeting from a presentation from the healthcare committee and their report. So their response echoes what was in that report. First of all, they also want to focus on creating additional emergency shelter and respite options. And the strategies they requested to add to the full PHB strategic plan is to improve care coordination and discharge planning, as well as increase direct care in sheltered environments. And Chris, you are on that committee. Would you like to speak to those?
Yes, we just started our action committee to make some of these actions move forward. So the need to prevent people from getting into more desperate homelessness is to make sure that when they are discharged from hospital or when they are passed from doctor's office to referral to pharmacy, et cetera, that we actually start to create pathways for them to get help and maybe even get services while they're in shelter. And so some of the ideas that have been floated have been pretty cool about that.
Thanks, Chris. Oh, Sean.
I'm supportive of adding these two. I mean, I think the presentation that healthcare committee did was fantastic and spot on. And I also hear between Pacific Source and Trillium and the hospitals, there's a desire to talk about those gaps and how do you solve them. And when you talk to the fire services here, right, there's a lot of places where they turn around and go pick people up, right, because they don't have a sort of a safe place to medically respite and take them back to the hospital, and that's just adding cost to the system.
Right. No, so I agree with you. And the last presentation was by Dr. Kincaid, and that team was killed. It was amazing. Yeah.
Embarrassingly good.
Yes, exactly. Michaela.
I was just going to say, I think it's a good idea to increase the direct care in the sheltered environments. I think that's super important.
Me too.
Thank you. And then we heard from League, the Lived Experience Advisory Group, which said they will work on all three main initiatives, of course, always the go-getters. And then they had 3 strategies with great detail. The first one, improving safety and sanitation, which includes adding proper disposal of waste, bathrooms. That's something that that league has been working on. Strategy 2, facilities and drop-in, increasing availability of housing, shelter, drop-in, and other places for people experiencing homelessness. And strategy 3, system improvement and accountability. And here they talked about a really in-depth full gaps analysis to determine high areas of need as well as system gaps. And looking at who is not being served by our current system, which is, it's really hard and difficult to see when we have such a high volume of need of people who are actually at our door. But League talks about, what about people who are not in a state to come ask for help or to advocate for themselves to even get to knock on the front door. We also have 2 members from League here if you'd like to add to those.
I guess what I would just say is that something for youth specifically is that we get the runaround a lot on services. And so I think that, wait, that's what this is about, right? Like,
For the
like putting,
system
getting,
improvement?
yeah, okay, sorry. I know I was on the committee, I just,
You're good.
yeah, just making sure that services that aren't real or they don't specifically help with the specific thing, maybe get removed or just updated. Just updates on what kind of resources the community does have, because one of the most frustrating things is being told, go here, and then you go there, or call there, and then they just kind of look at you and they're like, what? We don't do that, or who told you that, and then, oh, go here, and it's very discouraging, so, yeah.
And I would just like to add safe places to be, places to have cleanliness and hygiene, and being able to make sure that when you're applying for services and you're denied, that we use those numbers to make sure that when we ask for contracting next time, or when we have budgeted for things in 1 year, that we don't roll it back the next year, because we've identified those populations. Persons with dogs, persons with medical fragility, seniors with incontinence. We have options in our community, but they're not actually there. And so the accountability part is, when you're discharged to the mission, call and make sure that the mission has beds. Don't just say we discharge to the mission.
Got it. I agree. These are good things. Anything else?
The employment subcommittee said they will focus on advocacy. And in particular, they're looking at supported employment opportunities.
Go.
The RFP Evaluation HMIS Committee said they're all in for all 3. Of course, data, RFPs, evaluation encompasses every strategy that we engage in. In particular, their strategies that they recommended were increased use of data in planning and decision-making, which includes additional gaps in system analysis, as well as visualization tools. I know that's something that our Human Services Division is looking at, as well as the Homeless Solutions Alliance, of how do we visually tell the story of all the work that's going on in a way that everybody can understand and get on the same page. The second strategy from the RFP Evaluation HMIS Committee is to utilize data to review and improve system performance metrics. We currently do that. So I don't know where else this came from.
I can add that. So part of this was a focus from the committee on wanting to sort of take on the role of really looking at our HUD system performance measures and taking a deep dive into those. So not just looking at where we are with those, but looking at strategies to actually move the needle and make improvements and make recommendations to this body about what could really impact those numbers. Some of that is obviously happening through our system recommendations and the things we're already working on. But some of those don't necessarily impact some of those and need more of a closer look from a committee. So that group wants to volunteer for that task. And then the other part of that is expanding evaluation. So currently we evaluate thoroughly our COC funded projects, but we want to expand that to really evaluate all of the programs that we are working with to make sure they're effective and efficient and the best use of our resources.
So just a quick question, Amanda. I think the hard data is really critical, but I wonder about sort of the stories and understanding, and I think the point in time helps people understand some of the challenges people are facing, but is there any attempt or any thought about how do we capture some of the, I don't want to say anecdotal, but, you know, the story, the real situation that people are facing?
Yeah, so we are doing some of that through League. League has taken on doing participant feedback sessions, for example. So we're going out to current programs, focusing on COC ones right now. We just did 2 this week, where we get feedback from current participants. The League group would like to expand that to all of our programs. If we have additional capacity, we're adding members. League members facilitate those groups, so it's peer-to-peer. And I think we can definitely look into ways that we can expand that even to people not in programs, of doing more focus groups with League. It's been a really great opportunity to get feedback and has been eye-opening. So those reports come to this group. There will be another one coming soon.
Wonderful, thank you.
And the third strategy the RFP HMIS committee wanted to add is to targeted outreach to increase the use of our homeless management information system. It's a really powerful tool, HMIS, that you can look at data. It helps us understand what's happening in our community, but it's only as good as the data that's in there. So we know there are lots of programs and things that go on in the community, other questions that get asked that if we don't have the data to answer them, we just don't have it. So having more partners at the table participating in HMIS. And then the Shelter and Supportive Housing Development Committee did not submit a response, but they were in existence when the original strategic plan was developed, and the majority of the assignments are actually already allocated to the Shelter and Supportive Housing Development Committee, and their main priorities are the 2 big ones from the entire strategic plan, which is create more permanent housing and shelter opportunities.
And if I may, on that particular committee, it's a committee that has been more or less without a charge. That is to say, the charge is so broad, it's been very difficult to focus it on a particular element of it. But we're in a position right now where we're getting some data back and recommendations back from the work groups on TAC proposals. The Shelter and Supportive Housing Committee, if you look at the membership of it, it's a pretty strong committee. You know, the membership is Ann Williams from St. Vincent's, Jacob Fox, Chris McAllister, the Mayor of Eugene, Lucy Vinnis, Sean Murphy, and Cheryl Balthrop. All people who are steeped in the charge of what can be the charge of the Shelter and Supportive Housing Committee. So Alec, you and I are meeting next week to talk about, to more or less brainstorm what is the next meeting going to be, which can be really a watershed meeting for the Shelter and Supportive Housing Committee. Noreen, you've been there sometimes. You're not actually an official member of that committee. But one of the parts of the discussion that we're going to have is the membership of the committee and whether or not the committee needs to be fortified or expanded. With all the extra time
Alex,
you have.
what do we need to, we've had the conversation, what do you want to do? Do you want to,
Are
what's our
there
next steps?
other recommendations to be elevated to the full strategic plan? I heard support for the healthcare committee's 2 strategies. Anything else you'd like me to add to the full strategic plan, and I can create a draft of what that would look like and have it ready for the next all-member meeting?
I'd like to suggest they're already there.
Yeah, I
I
would
think it's pretty
too.
robust.
Yeah, I don't see anything. Yeah, I mean, I think it's, to me, the material's there. I think you got to bring it to the rest of the board.
So I think what I'm hearing is to take the existing strategic plan and then sort of do a legislative kind of copy where you put in bold how new strategies would fit into plan. And then also, I guess the other thing would be if there are things that are redundant or, you know, I don't know that we want to have the discussion here. It's like, you know, when we first put together the strategic plan, we had a goal of doing 600 units of permanent supportive housing. We engaged consultants, and the goal became 350 units. Do we want to keep the goalpost at 600 in terms of what this group does, or do we want to align it with what the recommendations from the consultants are? So those are the kinds of things that we could do to fine tune.
I think that's a question for the full board.
Yeah, that's
I
what
think
I'm
it is, and I mean, because you can,
Not-
those of us who think aspirationally, I'd say keep 600, let's make it 6,000, right? Sorry, but I mean, there's just a need.
Right.
But the more practical folks would probably think maybe 350 makes more sense. But I think it is a larger board discussion.
So that's the, so that's helpful too, because I think, you know, you have the strategies or the action steps, and then you have the sort of some of the things in the plan that we sort of set some benchmarks or quantifiable measures, so we can review those as well.
Chris?
Stephanie and then Chris.
I mean, I think it's worth having some discussion about the unit goal, and part of this is recognizing that the 600 units was specifically for chronically homeless people. And so there's some definitional issues that prevent certain populations from qualifying from this
Good
unit.
point.
Also, those units are the most challenging and most expensive. And so if you could fill the need with special needs housing or just simply affordable housing, and that those are less expensive, and we might be able to get some of those going as well. But permanent supportive housing, you both have to line up the capital as well as the ongoing operating support. So there's some trade-offs in terms of thinking about the different kinds of housing that we're trying to produce in the community.
That's a really good point. Yeah.
I think that we should really, I don't think that some of the stuff is necessarily in the strategic plan. We may think that parts of it are, and we may be able to make arguments that may be covered in passing, but I would really like to enshrine the safety and sanitation in our updates. We need places for people to be. We need places for people to be outreached to. And as such, we won't get there if we just rely on local governments saying, we'll do what we can, $120,000, here's a couple bathrooms, and then just leave it at that. We really need to have a consistent effort to keep this going on. And we operate our emergency shelters on volunteers. Our main item here is Egan. So we need to maybe put something into our strategic plan of utilizing current systems to actually mitigate problems. Maybe our Egan volunteers could help out without having an Egan activation by having supervision or helping run some of the transitional campgrounds that were allowed by the governor. We need to do something now while we build all this other stuff, and I don't feel like there's any short-term bridging options that are currently in our strategic plan, and that's a missing part of a strategy.
Yeah, go ahead.
Yeah, I want to speak to that. That's a good reminder, Chris, because and we had this discussion. I can't remember if it was one of the meetings, the meeting that Lucy chaired. Pat couldn't be there, but one of the things that was discussed at the Shelter and Supportive Housing Committee was to take a look at the Egan model and our winter strategies, and specifically there was some discussion, not that Salem is in a better place than we are here in Eugene, Springfield, or Lane County. And if you've been reading the newspaper, you know they have they've had some missteps. But one of the things that's been discussed is around what kind of support do we need to do a better job, and then do we want a system like the one thing they do have in Salem is that they eliminated their 3-day weather criteria. So if there's any one night that it's going to be below freezing, they open up. And that takes more support and more organization. And so the discussion's been, how can we strengthen both Egan and then other volunteer activities in the county? Is there some way to support that? We worked also on the issue of safety. Because one of the issues around safety is the fact that in some cases there isn't consistency in volunteers who are responsible for sites.
Right.
And so for like in Salem, even though they are from different congregations or different civic groups, they do train, and the trained people who are responsible for the sites get a sort of a stipend or a wage for those activations. So there's an expectation in exchange for knowing all of the safety procedures and knowing all of the protocols and being on call for the event. There's a little stipend or compensation for that.
Okay. Yes, and I want to get this wrapped up because we need to move, but in terms of what it is we're going to do with this information, what's up?
I just want
Yeah, you've got it, yep.
Is there such thing as a 24-hour public bathroom here? Is there any that are 24-hour, 365?
I don't know.
Really?
Yeah.
Well, yeah. I'm just wondering because I know a lot of the times in the winter, they lock up bathrooms.
Right.
Yeah.
So that was
And
Another
for-
barrier.
It's another
Yes.
barrier, and there's also
Totally.
safety concerns and
Yeah.
how many
Yeah,
times do you replace a bathroom? I mean, there's all those things that have to be considered too. And I think, but that's something that needs to be looked at. So what are we going to do with this information? I think we want to bring it to the whole board is what I think we do.
And ultimately, cluster tactics under these strategies.
Right.
I very specifically look at what it is that we're doing, like 24-hour bathrooms.
Yes.
Like a sharing facility.
Yeah.
And the crisis center, which we're working on.
Yeah.
The county put $1 million into a crisis center this year. Marion County has one, which really
Mental
blunts a lot
health,
of
yeah,
the mental health crisis center.
right.
Yeah.
Right. Okay. So go ahead.
Okay, no, I'm just,
I'm gonna leave. It's not personal, based on the convoluted comment you made. Thank you, everyone. You bet.
thanks, Pat.
Pat?
Okay, are there any more comments about this? I'm thinking we probably have some public comment. We want to allow some time for that. Thank you, Diana.
I nominate Pat Walsh for, no, he's gone.
I do just have
Yes,
one more
Michaela,
thing.
could you,
I know, I'm
yeah,
sorry.
please.
Keep
No
doing
worries.
this.
Quick, if you could be quick.
I really just want to keep this in the front of people's minds, the flexible funding. I know that that's really hard, but that couch hopping is homeless. Couch hopping, you're not stable. And I just, especially for a young person who can easily become chronically homeless, I just think it's really important that we help those kids and they be seen just as much as someone who's on the streets, where I understand that it's like, there are some people who have greater need, but I think that a need is a need. So,
Yeah.
yeah.
Thank you.
Yeah.
Okay, so we're going to wrap this up so we can have at least, it looks like maybe 5 or 6 minutes for public comment. And so I've got a list. I'm going to start there. Can we start with Melinda? Melinda, could you please, less than 1 minute, but please. Come up to the, microphone. Please come to the microphone.
I apologize. I've never been to one of these
Oh, no.
meetings before.
Great, welcome.
So I'd like to start off just by reiterating, I'm sorry you don't have a name tag.
Oh, Michaela.
What Michaela is saying about the flexible options. I'm a case manager. I have seen firsthand people actually actively coming up against the literal homelessness criteria as a significant barrier and occasionally choosing to leave the safety of like staying with a friend for a situation that puts them at a greater health and safety risk in an attempt to access services that they need. And so I just agree with that.
Thank you.
And then I have 2 questions, if I'm allowed to ask questions.
I don't know what the process is for that. We have probably 20 seconds for you.
Okay.
Go for it.
Is the focus group on the 23rd open? Or
Peter
is that
Siobhan?
like,
I think that's an open. I know I'm planning to be there at Peterson Barn.
No, I think
We're talking
those
about that one?
Those are
Are they closed?
by
Sorry.
invitation only. The
Okay.
people have been invited to those, yeah.
okay.
So there's one.
And then, and then I'm wondering for the point-in-time count, if there's going to be any representation at an organization that specifically provides services to people with developmental and intellectual disabilities, to make sure that that population is counted, because in my experience, they are less likely to be accessing some of kind of the standard centers of
Alex, can you take
access.
that question or respond to that?
I need to look at our list of providers who are signed up to answer that.
So maybe you two could connect afterwards. You can get
Yeah.
her email and you guys can, yeah,
Because-
that'd be great.
I can find you some volunteers for that if it's a gap that you need.
Thank you so much, Melinda. We've got a few
Thanks.
more
Okay.
folks. Thank you. Chris O'Neill next, and then after Chris is Josh. I think Josh might have gone.
don't know
Oh,
Josh
so
yet.
I see you. No Chris O'Neill? Maybe. Okay, Josh, you got a minute? And Ashley had to leave. She was after that. And then Majeska after Josh. Oh. Oh, hello, thank you. You know what, honestly, you're going to laugh at this, but I'm going to get my new glasses after this meeting because they've been sitting there for a week ready for me. So, sorry, Josh? That too.
In Oregon, at any given time, nearly 24,000 men, women, and children are incarcerated in Oregon's federal and state prisons, county jails, and youth correctional facilities. Nearly half of those incarcerated in prisons have been diagnosed with a mental illness or developmental disability. The Oregon Health Authority reports that every year in Oregon, an estimated 26,000 people are released from jails and 5,500 are released from state and federal prison. While the moral and legal justifications for this alarming trend are multifarious, what we can objectively consider are the cost of such a system. Such a consideration will take place at noon tomorrow as part of City Club of Eugene's forum on the cost of incarceration to our community. 3 individuals will qualify to examine the human and social and economic cost of incarceration will participate in the program. Presenting first is Captain Clint Riley, Lane County Jail Commander, who will be followed by Laura Johnson, Director of Program Development of Sponsors, and Andy Coe, Executive Director of the Partnership for Safety and Justice, a Portland-based criminal justice reform advocacy group. I request the attendance of the Poverty and Homelessness Board executive team at tomorrow's forum. I believe your consideration of our county's correction system will be valuable to your deliberation on poverty and homelessness. Thank you.
Thank you, Josh. Appreciate it. Dan, you're the last person that says yes on this list. Thank you for clarifying.
For 6 years on this body, you don't know how hard it is to sit back there and keep your mouth shut.
Just don't do it.
Yeah, right.
Speak of any time.
And you've got a minute and a half.
Yeah, well,
Woo-hoo.
thank you. As Steve noted, I was at that focus group looking at the site location, and after pondering this for some time, I want to go on record in supporting what Chris' comment earlier, except that I want to oppose one of the sites because we have an incredible opportunity, and I don't want us to miss it. So the one site, the building, I think would be an ideal site for a navigation center with specialization on medical services. We need more than 15 beds. We easily could fill it with however many we can put in it. If you just looked at the coordinated wait list and just ask what are the needs of the people on this list and design the services at that facility for those people on that list, I think it would be easily filled. A case example, many of you know a woman who hangs out in this area, has for over 10 years, lives on the street, and some of you may even know her name. I learned this week she had a stroke. She's paralyzed on her left side. Hospital is about to release her. She is mentally incapable of taking care of herself as well now with this physical need. It would be an ideal facility for someone like her. So I'm really pleased that Steve brought the example from King County. One of the major players in King County is the Low Income Housing Institute. Please look up their website, LIHI, LIHI.org. We have followed them very closely at Square One Villages. They are one of the largest affordable housing providers in the Seattle area, 60 sites. They serve in 6 counties, 2,200 units. They maintain 9 tiny home villages, so you can see where I'm going here. And I think that the criteria we set of looking for sites of 1 acre because we were limited by the TAC report was a serious mistake. It would cost $800,000 for the sprung structure. We easily could build 75 tiny homes for that cost. I think a much better model is to have 3 smaller sites of a 1/3 acre or less, if you use the Lehigh model. Little pocket communities of 25 people, a tiny village, halfway between Opportunity Village and Emerald Village, if you know our 2 models. Tiny homes that have power, that have a laundry bathroom facility that everyone shares, is much better than a single site, 75 people under 1 roof. And I think that that model would serve us much better. It would allow for greater specialization at each site. It would spread it throughout the community rather in one location. When you have smaller groups, you have less conflict that you have to manage. Believe me, I know a lot about this. It's much healthier for the people served. So I just want to put that model out there officially.
Thank you,
I've been talking
Dan.
about it for a while.
Yes, thank you for sharing that. Appreciate it.
Thank you for the time.
Yes, you're welcome. Anything else for the good of the order? If not, we're adjourned. Get a list, sorry.